Nice. Let me invite Danielle Dean and Dr. Howard Frumkin up to the stage. Thank you so much, Hakeem Bellamy. Let's give him one more round of applause for that. It's always tough to follow a talented spoken word artist, but I know my next guest, my colleague, is up for the task. We have a very special speaker for you, Dr. Howard Frumkin, and here to introduce Dr. Frumkin is one of my newest colleagues at the Joint Center, Danielle Dean, who directs the Joint Center's Energy and Environment Program. She's going to tell you a little bit more about that, but obviously that has many important intersections with health and health equity. Danielle came to the Joint Center after 8 years of programming with the Hewlett Foundation, and we're very fortunate to have her with the Joint Center. She'll say more about the work that she's doing, and she's going to introduce our keynote speaker, Dr. Frumkin. Danielle?
Good morning. As Brian mentioned, I'm the newest member of one of the newest members of the Joint Center family. I've been the director of the Energy and Environment Program just for the last 6 months. So I am pleased to be at my first Place Matters conference and met many of you on the bus tour yesterday and look forward to meeting many more of you today. I am so pleased to introduce Professor Frumkin, since the work that he is doing helps to illustrate why the Joint Center in 2008 launched work on energy and environment. At the time, at the launch event, then Senator Barack Obama helped bring attention to the launch of the Joint Center's commission that got pulled together, a high-level commission to help guide this work. It's now known as the Commission to Engage African Americans on Climate, Energy, and the Environment. And at that time, he highlighted some of the things that Dr. Frumkin will highlight, and an issue that's a theme of this conference, that we have to do a lot better job at collaboration and at bridging the divisions that might exist locally and regionally and between the public health, quote-unquote, and the environmental worlds to help address the inequities that we see in our communities. I was so struck yesterday on that bus tour, that last stop that we had in Washington, D.C. in the Northeast area, on the work that the gentlemen at Groundwork were doing to help clean up a branch of the Anacostia River. They highlighted for us that, yes, place is important. They're doing all they can. That gentleman had these young men out there in the rain, in the cold, making sure that garbage traps were working, finding innovative technologies. They weren't waiting on others to come in to start solving problems in their communities. At the same time, they recognized that they could not solve a lot of the problems that they were addressing without a strong environmental protection agency, without stronger work at the state level, at other states around us, and at the federal level. They were understanding the linkages and trying to figure out better ways to collaborate. We have that challenge here at the Joint Center, and in the next few weeks, Dr. Smedley and I will be reaching out to you to share more about the plans for the Joint Center's Energy and Environment Program that we're now expanding, and to get your feedback and your insights on how to better get the collaboration that we need between the Place Matters works and the work that's happening in the environmental field. We know many of you are already working on this. We're trying to figure out how best we at the Joint Center, given our role, support those efforts. As we think about what's needed, again, I'm so thrilled to introduce Dr. Howard Frumkin, who works tirelessly to help forge these collaborations and help us figure out how we use all the tools in our toolbox. So let me share some highlights of his bio. Professor Frumkin is Dean and Professor of Environmental and Occupational Health Sciences at the University of Washington School of Public Health. He's also an internist, an environmental and occupational medicine specialist, an epidemiologist, and he's worked both in academia and in public service. From 2005 to 2010, he led leadership roles at the U.S. Centers for Disease Control and Prevention. First, as director of the National Center for Environmental Health Agency Toxic Substances and Disease Registry. And later, he was special director at the climate change and health area of the CDC. During his tenure, he created, among others, programs in climate change and in healthy community design. He's several people in one. I'm convinced that he's got a twin somewhere, and they show up alternatively. From 1990 to 2005, Dr. Frumkin was professor and chair of environmental and occupational health at Emory University. He currently serves on a number of boards, and I'm going to list just a few. The Bullitt Foundation, the Children and Nature Network, the U.S. Green Building Council as public health advisor. He serves on the National Research Council Committee on Sustainability Linkages in the federal government, on the Yale Climate and Energy Institute External Advisory Board, and on Procter & Gamble's Sustainability Expert Advisory Panel. He's previously been on the board of Physicians for Social Responsibility, the chair of the Science Board of the American Public Health Association, and the EPA's Children's Health Protection Agency Committee. His research interests include public health, aspects of the built environment, climate change, energy policy, nature contact, the toxic effects of chemicals and environmental health policy. He's the co-author of more than 200 scientific journal articles and chapters. His books include Urban Sprawl and Public Health, which was a top 10 book of 2005 by the Planning and Development Network, and his other book, among others, includes Environmental Health from Global to Local. Please join me. I'm so thrilled to welcome Dr. Howard Frumkin.
Thank you very much, Danielle. What a copious introduction. Good morning. I love this. I've been in Seattle for 2 years now, and it's a wonderful place. We have some of my King County colleagues and fellow travelers here. But one thing about Seattle is when you say good morning, you know what they say back? Nothing. They look at you funny. Some people say it's that history of Scandinavian reserve, but it is a reserved place. So this brings back my days in Georgia when you say good morning and people actually say good morning back to you. How do I advance slides? Is there a button here, or do I just say next, please? Well, let me try saying next, please. Now, that doesn't work either. We're going to pause for a button quest here. Let me, while we're figuring out how to do this, I want to thank you. I want to say how much of an honor it is to be here as part of this conference. This is extraordinarily important work that you all do. And the Joint Center has been a jewel in the crown of this nation's journey toward racial equality and justice and health for all. The Health Policy Institute, Brian, is a jewel on that jewel, and the work that you do is superb. To all the funders in the audience who were thanked earlier by Ralph and by Brian, I want to add my thanks. As an objective outside observer with no dog in this fight, I want to tell you, the funders, that your investment in the Joint Center and in the Health Policy Institute is a well-placed investment. This is a think and do tank that is making a real difference, so thank you for your support. Next, please. Brian, the one thing I'm not going to forgive you for ever is making me follow Hakeem on a podium. That was a superb presentation. Thank you. I want to pick up on the fish metaphor that was part of Hakeem's reading. Imagine for a moment that you are a zookeeper. You're sitting in your office in the zoo one morning and you get a call that a shipment of fish or frogs or butterflies is about to arrive that afternoon. What's the first thing you do? The first thing you do is consider how to prepare for them the right habitat. You'll know something about the needs of those butterflies, something about the flora, the fauna that they need to be with, the temperature, the humidity, the light, and you'll take it on yourself to construct for them the proper habitat. Your metric of success will be if they thrive and flourish. And by the way, if the yellow butterflies flourish and the green butterflies don't, that's failure. That's not success. You want to be sure that all of the butterflies in the habitat are doing well. Well, it's remarkable, isn't it, how rarely we think about human habitats the same way. What's simple common sense for a zookeeper seems to be elusive for many of our policymakers and decision makers nationally. Next, please. If you were to imagine the human habitat as a place that would fulfill the needs of our species, you might construct a list that would look something like this. This isn't rocket science. We know something about what people need to thrive and flourish. And you might take these as design specifications. This is a design challenge for architects, urban planners, landscape architects, and other design professionals, because if we can create human habitats that provide these needs for people, we go a long way toward helping them thrive and flourish, which is, after all, the metric of our success. Next, please. Now, I want to confess up front that this animal metaphor is only a metaphor, and it doesn't do full service, as metaphors rarely do. We are complex creatures, and the sense of place that we have goes deeper than it does for animals. We take inspiration from the places we inhabit. We come from a place. We feel at home in some places. And we know a lot about those deep and profound feelings that help us thrive and flourish in places. Next, please. But what I'd like to do today is be a little more reductionist and take you through some specific elements of the built environment: housing, schools, parks, neighborhoods, and transportation. Review for you a little bit the evidence that these factors have something to do with our health and well-being. Next, please. Review for you the evidence that there are equity issues that arise in each of these domains, and talk about how we can design and build these domains so that people can thrive and flourish. Next. And finally, I want to wrap up by talking about the broader context of all of this. This will link to some of the work that Danielle does at the Joint Center, looking at energy and broader environmental issues. I'll make a call for the need for long-term thinking, and I'll talk about the question of Cobenefits, which is a good news story to wrap this all up. Next, please. So let's begin with housing. Housing is the place where we spend probably as many waking hours and sleeping hours as we do in any other part of the built environment. Next, please. Now, housing is a little bit of a sterile term. Housing is also home for most of us, and home connotes something beyond and deeper than housing. As Maya Angelou said, the ache for home lives in all of us, the safe place where we can go as we are and not be questioned. Next, please. Robert Frost famously put it in a more ironic way: home is the place where when you have to go there, they have to take you in. Next, please. And no less an authority than Confucius reminds us that the quality of home life, when aggregated over our society, has a lot to do with the strength of a nation. So home is a concept that includes housing but goes beyond housing. Let's just talk about the nuts and bolts of housing to begin with. Next, please. Housing can present a wide range of hazards, and unfortunately it all too often does. You'll see them listed here, and I won't read you the list, but we are well aware that these hazards in housing are predictors of conditions such as asthma, such as low academic achievement, such as mental illness, and so on. Strong associations between poor housing quality and those indicators of failure to thrive. Next, please. One of the particular hazards that we're seeing more and more of is mold. We've seen that in the aftermath of the flooding in the Gulf region in recent years. And this is a reminder that the profile of housing hazards isn't static. As particular challenges such as storms and flooding increase, which they will with climate change, we will see particular hazards such as mold become more widespread. Next, please. We know that there are great disparities by race and ethnicity in housing. One of those disparities is simply the availability of affordable housing. We have a shortage of affordable housing in this country. You can't be in healthy housing if you're not in housing to begin with. So providing adequate affordable housing for all of our citizens has to be a priority. Substandard housing also is the subject of disparities. Next, please. Next slide, please. Thank you. On the other hand, we have great opportunities in the housing arena. We've got the growth of new building techniques known as green building. We've got certification systems for green housing now. And when we get that right, housing can be environmentally sustainable and green and healthy for the people who live there. And by the way, the construction of green housing, the learning of the techniques that it takes to build green housing offers a wide range. Oh, thank you very much. Control. And there are buttons on here that say backwards and forwards, which is great. So I promise we'll move forward through the talk. So lots of opportunities in the housing arena for improving health, welfare, and job opportunities. Sufficient affordable housing, the control of hazards, Green, healthy housing, the next generation as we build new housing, places that will be environmentally sustainable and will be healthy for the people who live there, and policies to support all of this from the federal level right down to the construction codes, the zoning laws at the local level that impact the kinds of housing that is built, where it's built, and so on. Second domain, schools. Now, schools offer many of the same inside the building challenges that houses do, and I've listed some of them here. Only schools offer them in an intensified way in several respects. One is that the population spending time in schools are children, and children have special vulnerabilities to many of the hazards that are listed here. Another is that schools tend to concentrate certain hazards. You would be amazed at what can be found deep in the closets of chemistry labs and art classes and shop classes and the janitor's closets in schools. Mystery chemicals that have been there for a long time. Nobody knows what they are. So the combination of crowded conditions, of young and therefore vulnerable people in the schools, and hazards that are sometimes quite pronounced make schools a potential for indoor air, indoor environmental quality challenges that undermine safety, health, and academic achievement. Another aspect of the environment in schools is the food environment. In some schools in this country, students still receive the visual cues you see here, calling on them to stuff themselves with nutrient-poor, calorie-rich foods. You'll remember the story of the Pied Piper tempting children to go where they shouldn't go. Well, this is an example of putting the pie right back in Pied Piper, not only in schools, but near schools. The food environment in the communities near schools in many of our cities is an unhealthy environment. These are results from a study in Chicago showing that there is a clustering of fast food establishments near schools. Now, the data aren't all in on the impact of this phenomenon, but more and more we're seeing data showing that when there are fast food establishments concentrated near schools, the children in those schools eat more fast food and gain weight faster than if those establishments are not located near schools. Probably not as true in rural areas, certainly true in urban areas. So this calls on us to think about the environment both within schools and around schools, and to think about what sorts of cues we need to be giving our children. Another aspect of the around the school story is transportation to schools. You all know this, but I'll show you the data here. The proportion of students who locomote to schools on their own, using their feet or using their bicycles, has dropped precipitously in the last generation. When parents are asked why that is, they cite two major concerns, both having to do with safety. One is the possibility that there will be an accident along the way and their child will be hurt. The other is the possibility of stranger danger, that their child will be attacked by a predator along the way. The first is a design feature. If schools are near homes and if there are safe routes for children to travel to schools, then children can locomote under their own power. That's really good for their health. That means physical activity is a routine part of their day, and it establishes patterns of being physically active that last a lifetime. Now, where do we put our schools? Well, this is the common practice these days. We put schools out in the middle of nowhere. More and more suburban school districts are looking for that 30-acre parcel of land that they can afford. It happens to be miles away from anything, and they put the school there. These are two pictures of examples. The one on the right is Hubbard Lake Elementary School in Michigan, whose motto really is outstanding in its field. Now, the problem, you put a school way out there, no child for the useful life of that school will ever walk or bike to school. The alternative is a situation in which many of us old-timers grew up, where the school is embedded in the community and where the links between where children live and where the school is are thoughtfully put in place so that children can safely walk and bike to school. The Safe Routes to Schools programs around the country are very, very admirable programs where not only is the infrastructure attended to, but programs that call on community members to get together, in some cases to escort the very young children to school, giving parents the assurance that this is going to be a safe journey for their children. It's a very positive approach. So within the school facilities, attending to lighting, to indoor air quality, to cleaning procedures, don't use toxic cleaning chemicals. If you are going to use cleaning chemicals that are at all irritating, do the cleaning on Saturday. Don't do it during the week. Crime prevention through environmental design, or CPTED, is a design strategy used at the community level, but also within schools, keeping eyes on where trouble spots may be, keeping places open, and in other ways building so that the community presence can reduce the possibility of crime and violence. Safe playgrounds and sports fields, good food for the children to eat, good neighborhood settings for schools, and to achieve all of this, collaboration well beyond the health sector, as we've heard reference to this morning. Schools and health agencies and planning agencies and transportation agencies all need to be working together to achieve the kinds of design challenges that I've mentioned. Third domain of the built environment that has a lot to do with health and well-being is parks and green space. Parks range from huge collections of land in the center of great cities like Central Park in New York that you see here, to some of the cities that have captured their waterways and created beautiful parks. Here's Fairmount Park in Philadelphia. Here's Rock Creek Park just a few miles from where we are today, all the way down to the small pocket parks and patches of greenery that grace many of our cities and towns. Now, parks and green spaces within cities provide venues for relaxing, for being physically active, for having time with family and friends, for cementing social connections, and in all these ways, parks serve a very useful function. When the green space happens to be a community garden, it goes even farther than that, providing fresh food, providing a sense of community empowerment, building skills, especially in children who may have no other opportunity to learn where their food comes from and how to create that food. But the value of parks and green space may go beyond those identifiable factors. There may be something about nature contact that is good for us, something rooted in evolutionary history. Let me show you a few snippets of evidence to support that notion. This is a study from Copenhagen looking at people who live near parks versus people who didn't live near parks. People who live near parks reported lower levels of stress and lower rates of obesity, a relationship that was not fully explained by being physically active or even by going to the parks. So something about that proximity to green space seemed to have a positive impact on the people who lived near it. This is a study from Indianapolis looking at 3,800 inner city children and following them over 2 years. It took advantage of new GIS techniques that allowed the investigators to rate the greenness of neighborhoods. The neighborhoods ranged from quite green to not green at all. After controlling for social class, educational level, and other social factors, it turned out that the greener the neighborhood, the slower the rate at which children gained weight. Something about a green neighborhood is good for raising children. This is a study from colleagues at the University of Pennsylvania in Philadelphia, a beautiful capturing of a natural experiment. There was a program in Philadelphia to green vacant urban lots, but they couldn't do them all at once. Some were put off for a while, some were done in the short term, and that enabled the study of the difference between neighborhoods where the vacant lots were greened and the neighborhoods where that didn't take place. If you were in a neighborhood where the vacant lots were greened, you had lower self-reported stress levels, you had more exercise, and the rates of violence declined. Something about the presence of greenery in a neighborhood had a positive impact for the people who live there. Famous series of studies in Chicago. These were the Robert Taylor homes, 28 identical high-rise towers over a 3-mile stretch, bounded by a highway on one side, railroad tracks on the other side, a classic example of one of the large public housing projects in the country. The Robert Taylor homes provided an opportunity for study as well, because some of those buildings were surrounded by trees, as you see here, and others of those buildings, which were architecturally otherwise identical, had no trees at all around them. So investigators at the University of Illinois took that as an opportunity for study, and they compared the well-being of the people who lived in the buildings with trees nearby and the buildings without trees nearby. They were very thoughtful about it. They looked only at people living on the first few floors where they could see trees out the window. They paid attention to the seasonality because the leaves are only on the trees in Chicago for about 2 or 3 days, I think. And they interviewed people who lived in both kinds of buildings, buildings without trees, buildings with trees. In the buildings with trees, there was a substantially higher probability that you knew and greeted your neighbors, that you acknowledged and helped your neighbors when they needed help. There were lower levels of psychological aggression, there was less violent behavior, and the children in the buildings with nearby trees did better in school, all compared to the buildings without trees. Something about having trees nearby exerts a tonic effect on people. And finally, let's look at the disparities issue. This is a complicated slide. I apologize. This is the most complicated slide I'll show you today, but I want to walk you through this because it offers potentially very interesting insights. This is from a study in the UK. The UK, unlike the US, collects data on social class. What you're seeing here is mortality differentials by social class. So just look at the first bundle of columns, the one on the left that says no green. What you see there is 3 out of the 4 quartiles of social class. The lowest quartile is at baseline, that's 1. And then you see the relative risk of mortality as you go up from the shortest bar to the tallest bar. That is declining social class. So what you see within that first cluster is the well-known relationship that as your social class declines, your mortality rises. This is a well-known phenomenon. Then what the investigators did was stratify their observations across different levels of green neighborhoods, from neighborhoods that had no greenery in them at all, dense urban neighborhoods, all the way to quite green neighborhoods. And what you see is that mortality differential by social class is preserved, irrespective of the amount of green in the neighborhood, but it attenuates. So if you look all the way to the right part of the graph, those 3 little bars are in very green neighborhoods. You still see the same pattern there, that the poor die at higher rates than the wealthy, but the differential has shrunk considerably. So the suggestion here is that something about place, in this case the greenery of the place, seems to mitigate the disastrous effects of social class on health. Now we don't understand these relationships very well yet. But the notion here that the injustices of social class, the inequities of social class, made a very complicated set of processes that turn those into health disparities, but it's possible that good places can help to mitigate those inequities. And as we learn more about that, this offers an opportunity to create places that will help improve people's health across the social spectrum. Now, we know that children need places to play. This is an American Academy of Pediatrics declaration a couple of years ago, coming out with the phenomenal observation that play is important for children's well-being. We've all known that for a long time. Increasingly, we have evidence that playing outside has a value above and beyond playing inside. Green places are good places for children to play. Best described in Richard Louv's book here, Last Child in the Woods, whose subtitle is Saving Our Children from Nature Deficit Disorder. I commend it to you. That has led to a movement to get kids outdoors, and I'm pleased to say that this movement, the Leave No Child Inside movement, has focused across the country in city after city on underserved kids who ordinarily don't have access to the great outdoors. So the notion of providing good parks and providing programming and social support to get kids into those green spaces and to show them the wonders of the outdoors is a very positive set of efforts. And I want to point out a park in my former county, in DeKalb County, Georgia. This is the Arabian Mountain Trail. Lest anybody think that parks and green spaces only can go or do go into well-off areas or majority areas. This is a beautiful park that was placed entirely in an African-American section of the county. How did that happen? Visionary leadership at the county level, who understood that these amenities were disproportionately distributed and prioritized the African-American parts of the county for new park installation. And here's this park. Now, I couldn't find a picture that showed the reality, which is that these trails are full of people. This is a very, very well-used park. Unfortunately, those empty-looking abandoned pictures there don't completely give you the picture. But the notion here is that parks and green spaces are a very important amenity in communities. There are inequities in some cities in terms of where the parks are and who has access to them, and those amenities can be fixed with appropriate political leadership and public will. We need more parks and green space in all communities. There needs to be adequate maintenance and law enforcement so that people feel safe going to the parks. These should not be places where people are worried about crime, drug deals, and so on. There need to be culturally appropriate, safe, fun, recreational activities for residents of all ages. In heavily Latino communities, for example, don't put in baseball diamonds, put in soccer fields. Talk to the community to understand what people want to have in their parks. And again, collaboration between health agencies, parks officials, community groups, and others will help to achieve this very important part of the environment for healthy, thriving people. Up to the neighborhood scale. Now, we know that the major approach to creating neighborhoods in our country over the last 50 or 60 years has been urban sprawl. It features the vast geographic expansion of cities, as you see here, all the way to the horizon, as far as the eye can see. It features the conversion of traditional land use at the urban edge, from forest and farmland to residential. It features low-density land use. It features low diversity land use or single-use land use, meaning huge swaths of residential land, as you see here, without a store or a school or a recreational facility in sight. It features low connectivity, meaning that it's hard to get from point A to point B on a line, meaning that people are very unlikely to walk on the journeys that they take. All of this comprises urban sprawl, and it has been the pattern of urban development in our country for the last 5 or 6 decades. The flip side of that coin has been the abandonment of central cities in many of the cities of our country, leaving behind shelled-out neighborhoods that become pockets of poverty. These are not neighborhoods that are suitable environments for people to thrive and flourish in. The broken windows theory is a theory from the world of criminology, but it certainly applies to public health and well-being. This is the theory that signs of neglect in a community beget further neglect. They dispirit people, and they send a message that people don't care. Although it began in criminology, it's been adapted to public health. Deborah Cohen at Rand and her colleagues created a broken windows index and found that that index, that descriptor of urban neighborhoods, is a strong predictor of conditions such as gonorrhea, other sexually transmitted diseases, violence, and so on. So these are dispiriting neighborhoods and need to be improved so that people can thrive and flourish in them. There is inequity in who has to live in neighborhoods like this. The American Housing Survey, a very useful source of data, looks not only at the conditions of housing but at the conditions of neighborhoods, found quite high rates of various signs of blight in neighborhoods across the country. As you can see here, too many of our households are living in neighborhoods that feature dispiriting attributes, such as the ones that are listed here. And disproportionately, people of color and poor people are the people who have to live in neighborhoods like this. Here's an example. This compares majority and black and Hispanic populations in the American Housing Survey. Neighborhoods where crime is a problem, you can see that there are disparities. Neighborhoods where litter is a problem, you can see the disparities. Neighborhoods where people feel that the police protection is unsatisfactory, you can see the disparities. So the neighborhood features in which people live are not equitably distributed, and we know that these things lead to poor health and poor sense of well-being. Now, the neighborhood healthy food availability is another feature, and as with schools, this is a problem that demonstrates inequities. This is a complicated slide. You can see black neighborhoods and white neighborhoods compared in the orange strip across the top of the slide, showing the profile of what kinds of food stores are available in the neighborhoods. And you'll see a couple of things. You'll see that the black neighborhoods have proportionally many fewer supermarkets than the white neighborhoods. Proportionately many more convenience stores and grocery stores, which often offer a poor selection of foods with relatively few opportunities to buy fresh fruits and vegetables. And there's a category of store called behind glass. These are stores that sell their food through bulletproof glass. You put your money through the slot, and then a rotating thing brings your food out to you. So a very different ecosystem of buying your food in the black neighborhoods compared to the white neighborhoods. This was in Baltimore. That correlates with a very big difference in what was called the Healthy Food Availability Index. This is created by investigators at Johns Hopkins, showing that it was much harder to get healthy food in black neighborhoods than in white neighborhoods. So very important disparities in this feature of neighborhoods. Now, what are some of the solutions? Well, one of the solutions is to move people to better neighborhoods where there is less poverty, to deconcentrate poverty. We now have results from the famous Moving to Opportunity study that I'm sure all of you are very familiar with, something that was supported by HUD, so thanks to the visionary leadership at HUD for supporting this study over many years. There was a health analysis of the Moving to Opportunity data recently published in the New England Journal of Medicine. For those who don't know this, it was a study that randomly assigned people to 3 groups. One of the groups received what were called low poverty vouchers. These were people living in public housing in the cities that you see listed there. They were in poor census tracts with a high prevalence of poverty. In the low poverty voucher group, they got housing vouchers and were required to move to a low poverty area and to stay there for at least a year. They could stay there longer if they wanted. In the traditional voucher group, they simply got housing vouchers, and in the control group, people got no particular intervention, and they were followed up over more than 15 years. There were a number of important results that flowed from this, thank you, showing that moving out of a neighborhood of concentrated poverty has positive effects. The level of obesity declined by 13%. Out at 10 or 15 years, it was actually a bigger decline at 5 years. It declined a little bit from there, but still an important improvement. The proportion of those who were very obese declined by 19%. The proportion of those with increased glycated hemoglobin, a sign of diabetes and poor control, declined by 22%. So being in a less poor neighborhood, a neighborhood with less concentrated poverty, seems to have benefits for health. So one solution to the problem of neighborhood blight is to allow people to get to places where there's a little less blight. Another is to improve the neighborhoods. And that is happening in many places around the country now as the market pressures are bringing people back into central cities. But the problem there, the downside, is gentrification. People who've been in neighborhoods for a very long time can be pushed out by the economic pressures of gentrification. That is bad for people's health and well-being. We have very good insight from the work of Dr. Mindy Fullilove and others that being displaced from your home place is bad for you. So what we need is better social policy to allow us, as we improve neighborhoods, as we remove blight and squalor, as we make neighborhoods better habitats for people to thrive in, that we not do that at the expense of the people who've been there for a long time and are of less economic means. So, bottom line on healthy community design: more density, mixed land use, activity centers, and housing diversity, in many ways the opposite of urban sprawl. Placement of food stores, medical clinics, and other essential services where people can get to them. Social policy to mitigate gentrification and to assure that people get to stay in their neighborhoods as the neighborhoods improve, and a lot of collaboration to make this all possible. And the last of these sectors that I'll mention is transportation. The transportation policy in our country is depicted by the picture that you see here. We are mostly a road-oriented transportation system in the country. The more roads we build, the more we drive, and the more we have the problem that you see here, which doesn't seem to be mitigated by building more roads. Meanwhile, we don't do enough about pedestrian infrastructure. It's often left out. This is a road scene that looks familiar to everybody here. When it's put in, it's often put in by the folk process instead of by deliberate building, as you see here. Roads like this may be good for moving cars. They're also good for playing a fun game called Find the Victim, when a hapless pedestrian tries to get across the road, as you see here. And when we do build pedestrian infrastructure, too often we send signals to pedestrians about how much we value their ability to walk. This one I call Sidewalkus Interruptus, using a medical term. This is a dislocation. And we have a drive-through culture where we've built so much of our commerce to enable people never to get out of their car. We have drive-through pharmacies, we have drive-through dry cleaners, we have drive-through eating establishments, we have drive-through opportunities to buy your coffee, to wash down your food. We have opportunities to drive through and get married. This is in Las Vegas. And speaking of life cycle events, we have drive-through funeral homes, believe it or not, what I call a break for the wake. You never have to get out of your car. We have drive-through irony. If you can figure this out, I would love an explanation. And please do not try to explain this one. Well, there you have a transportation policy that has made many of our cities and towns absolutely unwalkable. And this is a transportation policy that you would not develop if you were in a zookeeper's mentality, creating healthy habitat for the creatures, that is us, who live in the places we build. We know how to build places where people want to walk. Good trails and sidewalks, places to walk to, greenery, the presence of other people walking, and so on. Study after study in the last decade has shown that these factors predict walking. It's not just a matter of physical activity. In the Atlanta Olympics, when we took a lot of cars off the road, pollution levels dropped precipitously, and for 2 to 3 weeks we saw a precipitous drop in the number of children who were coming to emergency rooms and clinics for attacks of their asthma. Transportation policy leads to air quality, which is health policy. And we know that less driving means fewer people being killed on the road from car crashes, the major cause of death among young people in this country. So transportation policy is health policy. And we know that there are inequities in our transportation system. For example, the persistent problem that transit services often don't take people from poor neighborhoods to where the jobs are, to where the medical services are. So much better transportation policy that enables everybody to have access to transit to get where they need to go. It's a very important part of health policy. We need plenty of attention to transit and to pedestrian bicycle infrastructure. We need transportation equity in the way those assets are distributed in our communities. And once again, collaboration across many sectors: health, transportation, elected officials, urban planning, and so on. So I've gone through 5 aspects of the human habitat, and I've made the case for each of them that evidence shows that they are important for health, that evidence shows that we are faced with persistent inequities. Let me close up now by putting all of this in a broader context and by calling for long-range thinking and the concept of co-benefits. This is a simplified picture of all of reality. And what it illustrates is the first law of ecology. Everything is connected to everything. So I've been focusing on health and equity. Those are our topics in the conference today. But health and equity are only 2 of a range of social goals and challenges that are extremely important and that need to inform us as we design and create healthy habitats for people. Climate change is occurring. That will mean a whole set of design constraints and challenges in coming years. Under climate change scenarios, cities not only need to be healthy and equitable, but they need to be resilient to disasters. We need to do things to make cities less likely to be heat islands. We need to build cities that use less energy so that we contribute less to climate change. We will be running out of petroleum in coming decades. That means that the demand for suburban homes will decrease as gasoline prices rise, and that means that we will need to anticipate more people wanting to live in cities, meaning that we need to make room for a lot more people and re-envision our transportation system. We will be running short of a number of resources, land and water among them. That means that we need not only to design and build healthy places, but places that use less land and use less water and are more resource efficient. Healthcare costs are continuing to rise. That means that primary prevention, which is one of the main beauties of good, healthy habitats, will be increasingly important. We know that we have a growing population. We expect to get up to well over 400 million by the year 2050. That means we need places for more people. We are an increasingly diverse society. That means that we need cities that are acceptable to and inspiring to a wide range of cultural preferences. We are an aging population. That means we need places in which people can grow old, stay in place, be able to get around, possibly without driving. And for full disclosure, that's me there, aging right along with my demographic. We have increasing income inequality in the country, meaning that the question of equity in the places we design and build is continuing to be an extremely important challenge. So a very wide range of challenges. We can anticipate that those challenges will emerge over time. The Iroquois nation famously had somebody in each of its councils who was responsible for representing the interests of the 7th generation yet unborn. It's a very inspiring model for thinking. if we were zookeepers building habitat for animals and we knew that that habitat was going to be around for 50 or 70 or 100 years, believe me, we would be very thoughtful about the long-term implications of how we build. We need to do the same for the places we build for each other. Thinking long-term for those of us in health means that we convert from the patient perspective that we have as clinicians to the community perspective that we have in public health to a legacy perspective where we join with the faith communities and others to think about the legacy that we leave behind. Finally, the good news of Cobenefits. This is a picture of a label from the medication that my mother raised me on in the years after the First World War. This is called the Bonnor's electromagnetic bathing fluid. And as you can see from the label, it cured neuralgia, cholera, rheumatism, paralysis, hip diseases, measles, female complaints, and so on. And it really worked. I never suffered from any of those conditions except I had female complaints in junior high school, but we all did. Well, we actually don't have a medication that cures all of those diseases, but we do have some design interventions, some place matters interventions that offer an enormous range of benefits. Let's just think about something simple like trees. Trees are good because they sequester carbon. They help mitigate climate change. Climate change will be very bad for health. They help cool places down, and they help avoid that urban heat island effect that will become more and more common. They reduce energy demand, meaning less demand on power plants during those summer seasons when people are running their air conditioners, meaning less air pollution. And they help clean water and clean air and all the way down to spiritual fulfillment. Simple intervention, planting trees in cities, a wide range of benefits. These are called co-benefits. Transportation. The simple fact of walking a child to school, in this 1957 picture, the last known time this happened in America, it offers a range of benefits, reducing carbon dioxide emissions from the car that's not running, and giving them physical activity, and reducing the risk of injuries by taking them out of that dangerous microenvironment, which is the car. Building social capital by meeting and greeting neighbors instead of shaking their fists and hurling imprecations through the windshield of their car at their rivals. Reducing the risk of osteoporosis for mom. Reducing contributions to air pollution. Physical activity is an effective antidepressant. In addition to all those benefits and more, if we have to build fewer miles of roadway, we have more public funds available for health care, education, law enforcement, and other social goods. So with that, let me thank you for your attention. Let me call on all of us to envision change, to believe that when you see a neighborhood that looks like this, we can build residential over the commercial, we can green the neighborhood, we can put in transit and bicycle lanes, and create healthy habitats in which people can thrive and flourish. When we see barren corners like this, we can envision doing something better. We don't need that parking lot. We can put a building there with residential above and commercial below. We can improve the pedestrian infrastructure, and just like a dedicated zookeeper, we can create great habitat for the creatures, that's us, who live there. We can look at the old inner ring shopping malls that are failing around the country and envision those as ecosystems for people. We can put in residential above the commercial so that the people who work in those shops can afford to live near where they work. And we can green them and improve the infrastructure so that they become healthy places for people. In sparse suburban corners, we can put in pedestrian infrastructure. We can do something to slow down the traffic so people don't blast through the intersections. That gives the pedestrians and cyclists a chance at survival. We can create healthy human habitats. In a nation with pressing health problems, in a nation with persistent health disparities, in a nation with many emerging environmental and resource challenges, we can and we must build safe, healthy, sustainable, and attractive communities for all people. Thank you very much for your attention, and thank you for the good work you did.
Thank you very much, Dr. Frumkin. I apologize, our time is tight. We're a little bit behind. Dr. Frumkin's going to stick around during the break. He can answer questions. We also have his book for sale, Making Healthy Places, which is available out in the lobby.